The research has shown that 90% of disease start in the gut, but the gut starts in the mouth. Imagine that the teeth are like an egg. The outer layer is the hardest structure in our body. I read the most updated data and I was blown away understanding that bacteria spread through chewing. So we chew bacteria, we swallow them. Some simple changes that you can make that are going to impact your health. Stop. I'm Dr.Maria Florou and this is Mind Your Mouth. I'll be sharing with you the truth about oral health that most people completely overlook. If you're ready to go beyond the basics, challenge the myths, and truly transform your well-being, let's get started. Welcome to Mind Your Mouth. On this episode, we're going to talk about how the mouth plays a very important role when it comes to your overall health and what's happening to the rest of your body. But we're also going to talk about habits and things to do and things not to do in order to keep your teeth in good check, but your brain, your heart, and even your sexual performance during what we're going to talk about today. So stick to this episode, watch to the end. There will be a lot of information that can help you live a better life, but as well as your friends and family. So share this episode, listen to the end, take notes, and change some small habits, and you're going to see a big impact in your life. So let's get started. First, I want you to think and answer to yourself honestly, which category are you in when it comes to oral health? Are you, one, the person who flosses at least twice a day and brushes twice a day? On top of that, you go to the dentist at least twice a year or in the way that your dentist recommends to you. The second category here, it's when you floss just when it's possible, or if you feel that something is stuck there. Sometimes you try to be good and you floss once a day or once every 2 days and you still brush twice a day. When it comes to going to the dentist, you go either once or twice a year, depending on how you feel about it. The third person is the person that brushes once a day, who doesn't floss or either goes or doesn't go to the dentist. It depends on how the schedule is, or they keep putting it off. So who are you in this scenario? Are you category 1, 2, or category 3? And that's a very important thing to understand, because this is not just how you feel, but it's how that's actually affecting your body silently. So stay to the end and understand what we recommend. Understand why we recommend 2 visits a year, why we recommend sometimes once a year. And some people are fine with that, but sometimes we need to see people 3 or 4 times a year. So watch to the end and let's understand the reasons why. Most people don't realize that cavities are bacterial infections. And when we talk about oral health and what happens beyond the mouth, that's really important to listen to this word, bacterial infection. Can you imagine yourself with an infection on your lungs that you don't treat, or an infection on your toes that you don't care about, or even an infection on your nose that you're not going to treat? That doesn't happen. But because the teeth are inside the mouth, not a lot of people see them. Sometimes you don't even have any pain related to them. You put it off. But let's see the importance and how that's really silently affecting your health. Tooth decay is the most common disease globally. So let's dive in the topic and understand things a little bit better. So the mouth is a very dynamic environment. We eat, we drink, we kiss, we talk, we breathe sometimes through our mouth. And all those factors play a big role on how our body is healing. But in this case, let's talk about our teeth. So the teeth go through a cycle of demineralization and remineralization. And I know that this can sound like a complicated word, but if we break it down, it means it breaks down minerals or it builds up minerals. So demineralization is when we have something that's happening in our mouth that's breaking down the nice and strong structure of our body. So for those who have never heard this, the enamel is like an eggshell. So imagine that the teeth are like an egg. The outer layer is the hardest structure in our body. So yes, enamel is the most mineralized structure in our body, even more mineralized than our bones. The second layer is dentine, which is a little bit more porous, a little bit more soft than the enamel. And the third layer inside is where the nerve and the blood vessels are, which means it's what we call a pulp. What's important about this, it's when we have the demineralization process happening, it's because we have some bacteria there, But most importantly, we have the pH of our mouth dropping, the ideal pH that we want to see. And if we're going to check on one of those pH strips that we can get from the pharmacy or the health food shop, or even you can get that online, you spit on it and you see where the pH of your saliva is. And what's ideal is to have a neutral pH, which means a pH of 7. I don't want this to be boring for you or to be too scientific, but it's really important to understand the subtle changes and how much that can really impact your oral health, and then we're going to talk about how that affects your general health. So when we drop the pH, the enamel is really strong and it withstands nicely without any damage the pH of 6. But when the pH drops to 5.5, imagine that eggshell is starting to break. It's starting to break. And then when we get to the white part of the egg or the softer part of the tooth, bacteria really goes crazy. It grows really fast. That also varies from person to person because it varies on how mineralized your tooth is. That is a very important topic when we look at children and how teeth form, and if they had a lot of fever, if they needed a lot of antibiotics, things that are going to alter how the enamel and how the tooth structure has formed. So I get a lot of people asking me nowadays, what is a way of reversing cavities? Yes, people are right, and I love this approach. It's something that I really incentivize my patients to do because we know that the body is an amazing machine and it does have the capacity to heal. But when does the body heal? So when the hardest structure, when the enamel is affected by low pH, by acidic pH, and bacteria start going in, and then eventually we have a remineralization process happening when the pH goes up again and we have a good environment for healing, the tooth tends to harden again. And that can contribute to the healing of the tooth. However, what a lot of people don't realize, and nowadays we see a lot of ads that, in my view, can be quite misleading, where we see, oh, this chewing gum is going to heal all your decay, or let's do this treatment. And we see this a lot on either, like I get it on my Instagram and I see it on YouTube. We see this in a lot of different channels. But what we need to understand is that, yes, the tooth will heal, provided that the cavity is only on the enamel. And that's a very important thing to listen to. When the cavity has gone to the softer part, which means the dentin, the dentin can't withstand a pH of 5.5 like the enamel does. Any drop on pH, so if it drops from 7 to 6, just by eating something or having an orange, let's say, or a cup of coffee, anything that's going to drop that pH will help that cavity to grow deeper and deeper. And that is a very dynamic process. So the body's constantly healing and constantly getting into a demineralizing stage. Another thing that can really influence this whole process, it's not just what you eat, but also how often do you eat? We hear a lot about fasting nowadays. And what's important about fasting? In our mouth, I'm not going to talk to you about 18 hours fasting or 2 days fasting and autophagy and other things. But what I'm going to talk to you about is how that influences remineralization, how that influences the healing of your teeth. And yes, the body is very wise. It's very wise in its systems, in the way that it regulates itself. So when we're looking at the saliva, when we eat, we tend to have a more acidic saliva. Why? One, because of the foods that we're eating, but also because it helps with the breakdown of food, and we want an acidic environment in the stomach to actually contribute to digestion, to stop a lot of the bacteria that we are swallowing from propagating to the gut. We want an acidic environment in the gut. So everything in our body contributes to that pH. When we stop eating, though, what does the body do? The mouth actually flushes new saliva and the pH goes up. And then it's when we start having healing. But imagine that someone is constantly eating, someone is constantly snacking on food. What happens then is that the pH can never regulate itself. So we're constantly on a small pH, on an acidic pH, on a low pH, I should say. So what happens then? We can't have healing happening. We can't have healing. And on top of that, if we don't have proper oral care, oral hygiene, the plaque is there. And what is plaque? Plaque are colonies of bacteria, and they just become more and more acidic the longer they stay in the mouth because they gain strength. We have new bacteria attaching and sticking onto the surface of the teeth, and that's when we see that we have constant food feeding the bacteria. We don't have enough time for healing on the saliva to elevate the pH, and the bacteria start penetrating on the teeth. So we have an acidic environment that's actually etching that enamel and opening the pores for the bacteria to go in. So I think this answers when people think that sugar is the main villain of oral care and oral health, and it's what causes tooth decay. In fact, sugar is not the only, obviously it contributes to problems with oral health and overall health, but the problem is the constant eating, the quality of what we eat, the pH of our mouth. Other things that really play a big role in this are medications. We see that some medications can contribute to a lower salivary flow, or for some reason we have syndromes and we have a lot of other conditions that contribute to a lower salivary flow. And that's when we see more and more problems happening, not just with teeth, but with the gums as well. So we need to think that we are one system and all those things play a role. Our body is wise in the sense that every organ, every cell has a cycle, and it's no different with saliva. So we have more salivary production during the day, especially during the morning. And as the hours of the day go by, we have less and less saliva forming. So what does that mean? It means that if we drinking a lot of caffeine, that's also going to drop our amount of saliva. So we know that with that drop in salivary flow, we have less water, less saliva flushing out the bacteria. But not only that, but also we don't have that alkaline pH in our body. So what to do and what not to do? First, allow your time to heal through a period of fasting. So what is ideal? Fast for at least 4 to 5 hours between meals. If you decide to have something sweet or an orange or something acidic, have it close to a mealtime so then your body has the chance to recover. Another thing to avoid is alcohol. Recent studies have shown the increase of the incidence of oral cancers, and that's a very important topic. Make sure your dentist is checking I tell my patients, I'm going to do a skin check, but in this case, inside your mouth, because I want to look at what's happening with the cheek, what's happening with the lips, what's happening with the roof of the mouth, the tongue. But what's important here, going back to our topic, is alcohol. Alcohol causes some dehydration. It changes how the good bacteria and the bad bacteria interact, and that increases the risk of problems in the mouth, not just oral cancers, but decay and gum disease. Also, as I mentioned before, medication. So some medications like antidepressants and stimulants can cause an alteration with the way you breathe or the flow of saliva. So talk to your doctor about it and see what can be done. See if they recommend either a different medication to you, if that's something that you feel that's affecting you, or what can you do to improve this situation. We know that on average, an adult should be drinking 250 ml of water per waking hour. In the case of people who take medication that cause dry mouth, or if you're a big fan of coffee and you drink caffeine along the day, that number should be increased. So you should drink more than 250 ml of water per waking hour under these conditions. The other thing that's really important, and please refer to some of our other episodes about this, mouth breathing. Mouth breathing is a big topic nowadays, but when it comes to oral health, apart from the detrimental effects that it has on general health, when it comes to oral health, we know that it causes dehydration of the teeth and dehydration of the gums. And again, that dehydration alters the number of good bacteria versus the bad bacteria that we have in the mouth. So when we breathe through the mouth, we're causing dehydration. The air is not being filtered, and we end up breathing more bacteria, more viruses, more fungus that in the air, and that can really affect our health. So in the case that, apart from when you're talking or laughing or exercising, you still need to breathe through your mouth, my recommendation is look for some help. Look for a myofunctional dentist or someone who can help you retrain yourself. And sometimes we need to dig further and we need to look into having complementary treatments in order to help us breathe better. That's a common problem that we face nowadays in our society, but it's not what we should be seeing. We should be seeing people breathing through the nose as a natural state. So we do have some inexpensive solutions. We know what we shouldn't be doing, but what could we do to improve things? How can we prevent these problems from affecting our oral health, our confidence, but also our response, our general health? So inexpensive solutions would be things like rinsing your mouth with some good quality bicarb water. Why say good quality? Because some bicarb water have aluminium, and we don't want any aluminium. We don't want to overload our body with this. So make sure that you're rinsing, or find a good source of alkaline water, swish around, spit out, help your body elevate that pH. The other thing that I'm sure you've heard 1,000 of times, and I've been through this in more details on previous episodes, is oral hygiene. So make sure that you're water flossing, make sure that you're tongue scraping, and make sure that you're brushing at least, and yes, you heard me correctly, at least twice a day. So it's a commitment that you do to your health, and not just to you. When we think of bacteria are contagious, and we are spreading that to the people we love, to our children, to our partners. So do this for yourself and do this for the people that you love. Now, how do bacteria travel from the mouth to the rest of the body? Look, I'm going to share this with you, and I have to say that I was researching to do this episode with the most updated information that's available today. I read the most updated data, and I was blown away by understanding that bacteria spread through chewing. So we chew bacteria, we swallow them. If our stomach doesn't have enough acids, that bypasses and goes to our gut. The other way that we do spread bacteria, it's through the bloodstream. So bacteria go inside the gums, between the teeth and the gums, and from there they just go to other parts of the body. The other way is through breathing. We inhale bacteria, and that's very important. But the one that really blew my mind when I read the research is that actually our bacteria go from the teeth to the nerve, and from the nerve they go back to our brain and to other systems in our body. And I was really shocked by that, because we do have a big talk on oral body connection, but when I heard that it affects the nerves, it explains a lot of diseases and a lot of complications that we see in patients who have teeth infections or gum infections, and how we see their health deteriorating over the years. It's not something that happens in a blink of an eye. Obviously, what's really important is how the body's responding, how the immune system is, but we know that these are very interconnected systems, and we need to protect ourselves the best way possible. The other ways that we see bacteria affecting our health is diabetes and generalized inflammation. So what happens, we know that nowadays the research has shown that 90% of disease start in the gut. There is a huge movement towards gut health. I speak to a lot of my patients, and a lot of them eat fermented foods, a lot of them take probiotics, and they do a lot of testing for the gut health. But the gut starts in the mouth. So one thing is connected to the other, and we cannot ignore this fact. And it's more and more important nowadays that people, and especially doctors and healthcare providers, understand the link between the mouth and the gut and the overall health. So the whole digestive system, it's very similar anatomically, and we have a lot of similar skin, I'll put it that way, from the mouth to the anus, which is very important to understand how bacteria really travel and how they get adapted to the system. So we know that we have more than 700 species of bacteria in our mouth. Can you imagine 700 species? Not 700 bacteria floating around, 700 species. So sometimes you look at the microscope, and the microscope is just flooded with bacteria. Some that like oxygen, some don't like oxygen. But what's really important, the good bacteria that we want to see, they are responsible for 25% of our nitric oxide. And nitric oxide, it's been really a big topic on the scientific research, because we know that nitric oxide helps lowering blood pressure. It helps regulate dilation of blood vessels, and in some ways the contraction of the blood vessels as well, which influence a lot of things in our body, including sexual performance. So if this is a topic that you need to learn more about, if it's a situation that you're going through, look into your oral health, because your answers could be there. As I mentioned on a different episode, we know that oral bacteria, especially the most aggressive types, they have been related to 57 types of disease, which means that people that have, for example, rheumatoid arthritis, when they treat their mouth and the gum infection, the arthritis improves. The same thing happens with diabetic patients, with Alzheimer's, patients with cancers. And once I had this person that I was working with, and her sister, which she was about the age of 40 at the time, she was diagnosed with a form of colorectal cancer. What happened at the time was that we had the opportunity to test her oral microbiome, and we saw that the bacteria in the mouth were really out of balance. And we found a lot of Fusobacterium, which is a type of bacteria that's been really correlated with some types of cancer, like breast cancer, but also colorectal cancer. Really, really important to not ignore these. And nowadays we have the resources. We do see patients, and we test all patients, we test their microbiome, because we know that if we don't look at those factors and we let them go in 10, 15, 20 years' time, they're going to develop diseases. The immune system eventually will drop, they go through stress, life in general, make not so good choices for themselves. And with those opportunistic bacteria there, they're going to grow and we're going to see more inflammation. And when the body is inflamed, the whole system suffers. So as I promised you at the start of this episode, when do we make the decision that we want to see patients twice a year or once a year or even 4 times a year, sometimes more? As holistic dentists, we're not just looking at if the person has cavities or if they have bleeding gums. That is just the tip of the iceberg. What we're really looking at is what is the microbiome doing? How is the salivary flow? And how are the potential risks of oral disease, but the potential risks of the overall health of the patient being affected as well? So if I see a patient that everything is fine, the microbiome is great, there's no history of gum disease, no history of cavities, I might say, depending on the age, that I want to see that person once a year. In the case of a person who has some cavities, low numbers, we're either monitoring them, or if they're very superficial, or they have no bleeding, but they're very, very diligent with their brushing and oral care, we want to see them at least twice a year. Anyone who presents with the microbiome, we look at the microscope in the practice, or we send for further testing and we see that we have bad bacteria, we have more of those aggressive bacteria types in the mouth, we really want to see this person really regularly. Because what we do, we treat them as like a very efficient treatment to minimize the number of bacteria. And then we need to follow up on them and make sure that we have decreased those numbers, that we have done our part, but also that the patient is doing what they have to do and looking after their health, seeing a doctor in the case that we need to refer to a functional doctor to help them improve their gut health, improve the immune response, and help us minimize the number of bad bacteria. So I hope I have answered your question on how many times you need to see the dentist and why. Guys, just to wrap up this episode, let's just quickly go through some simple changes that you can make that are going to impact your health in a good way. So 1, stop all alcohol-based mouthwashes. In general, stop all mouthwashes. Better than using a mouthwash is to rinse with some salty water. That is actually proven to be really good for your oral health and to protect your good bacteria. The other thing that I recommend, and we're going to talk more about it, is to stop the use of fluoride if you can, if it's a decision that you can make, and maybe you need to consult with your dentist about this. My recommendation to most of my patients is to actually use a nano-hydroxyapatite-based toothpaste instead of the fluoride. But we need to make sure that you put in place all the other things that we discussed as well. The other thing is tongue scraping. I don't want you to really go hard on your tongue. It's very soft, the plaque that we are removing, but make sure you're tongue scraping morning and before bedtime. And the other thing that I really recommend my patients to use is a chewing gum with xylitol, because xylitol has proven to feed the good bacteria and also to help remineralize tooth structure. There are also some oral probiotics that we can recommend. It's a very case-by-case approach, but that can be another thing that we could look into. Simple, if you want to take one thing from here, hydration. Keep your body well hydrated, keep your saliva flowing, and I'm sure that if you follow this advice that's been given today, you are going to feel a lot better and your dentist is going to be impressed next time they see you. Thank you for tuning into Mind Your Mouth. These episodes have been created for you. If you found this conversation helpful, the best way to support the show is by leaving a 5-star review on Apple Podcasts and Spotify. And don't forget to subscribe on YouTube so you never miss an episode. For more tips on holistic dental health, follow me on social media at Cavities Dental. In the meantime, take care of your smile, take care of your health, and I'll see you in the next episode.